Welcome. I am Alan Lewis, Dean of the School of Health Professions, and thank you for joining our final lecture in this inaugural offering of this lecture series. I have appreciated your participation and interaction in these sessions over this entire academic year. As you know, we've had one session per month for the academic year. Because of us using the virtual format with Zoom, we have really not missed a step due to the COVID-19 pandemic. As I have said previously on at least one occasion, probably on several occasions, embracing culture and cultural diversity really makes good business sense. The reality is that our world is becoming increasingly diverse with each passing moment. Our world and our country, the population demographics are changing, and as we know, by the year 2050, probably by the year 2040 or maybe sooner, we'll have at least half of our population, if not more, will be non-white in this country. So the diversity is here to stay. As healthcare providers, we have to understand how to work effectively in an environment where the diversity is increasing. We must have the tools to work well with every segment of the population that may show up at our doors. We cannot run the risk of having any subsection or subsegment of our population, or subpopulation, I should say, not be one that we can work effectively with. Because if we have a group that we're not effective with, we're essentially wasting resources. And we know that our resources are hard fought and scarce. So today, in this final lecture of our series, we want to talk about culture and the delivery of health services where the rubber meets the road. It's going to be a fairly short lecture because they're just 5 strategies that I want to share with you. But these are very important strategies. These 5 strategies are strategies that you have to embrace and make them a part of who you are in providing services as a healthcare provider to make sure that you have the ability to work effectively with everybody who shows up, no matter what that person's cultural orientation may be. You have the ability to provide effective healthcare services and not waste any resources. Again, our topic is culture and delivery of health services where the rubber meets the road. 5 strategies. You will be in the trenches as a healthcare provider, and you will really have to embrace and implement these strategies well. Strategy number 1, realize that you as a healthcare provider are in fact a cultural being yourself with your own baggage and biases. This is the first thing that many providers get wrong or don't do. They don't realize that when you go into the healthcare service delivery encounter, that process, you as a human being are taking all of you, and that service recipient is seeing you for all of who you are, the individual you are. And it's impossible for us to be totally objective and for us to leave who we are culturally outside of that encounter. It all goes with us. So the first thing in realizing your cultural being and your own baggage and biases is to understand your own worldview. What is your own worldview? What are the assumptions you typically make, conscious or subconscious, about people when you first meet them? What values do you typically embrace? What are your preferences and dislikes? What are your stereotypes? What preconceptions do you have about human behavior? Those are things that really do make up your own worldview, and you need to be understanding of what you need to understand what they are in a very explicit kind of way as you prepare yourself to be a healthcare provider who provides culturally competent services. The bias piece is very important. You must identify and manage your own cultural biases. And all human beings have biases. No matter how much education, experience, or expertise you have, you're always going to still be a human being. So you will have cultural biases, those preferences and dislikes that may contraindicate you working well with certain groups who have a particular cultural orientation. So you want to think about what your biases are from the perspective of culture. What cultural factors can invoke your biases in a way that will compromise and lower your effectiveness in providing services as a healthcare provider. In a previous lecture, I'm not sure what the number is right now, we did talk about a 4-step process for identifying your biases. So I would briefly review that process again. So the first step of 4 in identifying your cultural biases is to identify a bias. You need to think about all the things that can rear their ugly head related to culture and compromise your effectiveness in working with somebody in a cultural situation. So each bias that you identify, you need to go through these 4 steps in thinking about it. So the first step is to identify a bias. that can contraindicate your effectiveness as a healthcare provider. The second step is to think about that bias in terms of whether or not it's a bias that really is going to compromise your effectiveness. So the first step, I should say, is just to identify the bias. The second step is really to think about that bias in terms of whether or not it has the ability in its very essence and nature to contraindicate you being effective with the client that you're providing services to. That's determining its level of dangerousness, essentially. So if it's a bias that's not dangerous in terms of cultural factors, then it's not a bias you want to continue thinking about these steps with. If it is a bias that can lower your effectiveness in serving somebody of a certain cultural orientation, then you move on to the next step, which is step 3, and think about whether that bias is one that's open to change. Can you eliminate it or mitigate it to the point where it's not a factor? Some biases are that way, meaning that if you have more education, more awareness, more exposure to a particular aspect of something related to culture, it may make the bias less dangerous and maybe even make it go away. So if it's that kind of bias, then what you want to do is obviously avail yourself of whatever those resources are or those experiences would be to help that bias be mitigated or eliminated. Some biases are very deep-rooted, meaning they're not going to change no matter how much education, experience, and exposure you have. If you have one of those biases that you're dealing with and it relates to culture, which means it's dangerous, then you want to make sure you come up with an effective containment plan to try to mitigate that bias. Some biases you want to make sure that if they rear their heads in a counseling or healthcare service delivery process, that you refer that person to another provider because that bias is so dangerous. Or you may want to make sure you have more close supervision as you're working with the client to make sure your biases don't come into play to mitigate your effectiveness or limit your effectiveness. So the containment plan could have a myriad of different strategies, but you've got to come up with the ones that will actually be effective. That's the third step. And then the fourth step is really to just realize that as human beings, we all have biases, and that as we grow and develop and evolve as individuals, our biases can change. So what's a bias today may not be a bias 3 years from now. What's not a bias today could be a bias 10 years from now. Because as human beings, we grow and experience life and are influenced by our environment and our experiences, and the biases can come and go. So this means you must have a strong commitment to constantly be vigilant to what your biases may be. You've got to be self-reflective, introspective, and self-aware to constantly be thinking about what your biases are and how they may change over time, and engage in this 4-step process over and over again throughout the course of your career as a healthcare professional. Again, that 4-step process is to identify the bias, step 1. 2, determine if the bias is dangerous. 3, if it is, figure out how you can get rid of the bias or contain it, whichever option will work for the bias. 4, realize that you change over time as a person, and therefore you must be vigilant to understanding your biases and scanning for biases for your entire career, and have a commitment to doing that. Okay, strategy number 2. Recognize the importance of and work to establish a positive working alliance with the service recipient. By working alliance, I mean relationship, rapport with the person providing services to. We know from the research literature that the single most important aspect in a healthcare service delivery encounter that accounts for a service recipient feeling like healthcare services were provided that were effective is the strength of that positive relationship, that rapport, or that alliance with their healthcare provider. So it's very important. Even beyond, it even is more important than the types of interventions you actually deploy in trying to deal with whatever the healthcare challenge is and mitigate or get rid of that healthcare challenge, ameliorate it. The relationship is even more important than that, because the relationship is really what speaks to how the service recipient feels about what you have done for her or him. So don't shortchange the relationship rapport building process. Take adequate time to develop it, because in the end, it will yield positive resources and dividends for you. Actually, it yields positive dividends, not resources. Okay, strategy 3. Learn as much as you can, time permitting, but learn as much as you can about the service recipient's cultural identity and expectations about the desirable outcomes of health services. In other words, you need to understand how your client views her or himself in terms of cultural orientation, And you need to know what that client or service recipient is looking for in terms of the ultimate outcome of services through your interventions. Those are two things you have to be very clear on at the outset of services. So you have to have a way of developing a systematic and routine approach for collecting data about that service recipient that speaks to who she or he is in terms of cultural identity. And you have to ask and know in a very clear way what outcome they're seeking as a bottom line impact, positive impact from your services. So you have to have a way of getting at that information. You can develop your own way, or you can use something that's already in the literature, something called the three-dimensional model tool that I developed some years ago, that is designed to have you as a clinician go through a process of developing a tool that will serve as an interview tool, and it'll be a set of prompts from which there will be some questions that emanate out that will allow you to explore and question your service recipient in a way to understand who that person is in terms of one, the first dimension, cultural identity; second dimension, how they're functioning developmentally; third dimension, I call it in my model, the adjustment to disability, but it's really what outcome that service recipient is really seeking at the end of services. So what's the preferred or desired ideal outcome that person is seeking? Those are the three dimensions. So in developing a three-dimensional model tool, what you have to go through a several step process. The first step is to really think about each of those dimensions independently: cultural identity, development, and outcome of services. Think about each of those three dimensions independently and attach a theoretical orientation or conceptual framework to each one. And that theoretical orientation or conceptual framework has to be one that resonates with you, something that's intuitive to you, that you understand and you believe is relevant. Once you have that conceptual framework for each of those three dimensions, then you have to think about what questions will emanate from that, from each of those three frameworks. Now, in thinking about those questions, you got to have some additional considerations. You have to also think about what is the nature of the particular health challenge that of the people. What's the nature of the health challenge that people have of the service recipients that you're working with? You know, if you're working with persons who have brain injury, or if you're working in an acute situation like an ER, those are different types of populations that you're working with. So that will inform the types of questions that need to emanate from those theoretical frameworks or those conceptual frameworks that you have already identified in both the cultural identity domain, the human development domain, and the outcome of services domain. And then you got to think about, in addition to what those health challenges are that the people that people have that you typically see, you got to think about what context you're providing services. In other words, what's the milieu that you're working in? Are you working in an outpatient? Are you working in an acute setting? Are you working in a long-term care setting? Are you working virtually, providing telehealth services? Whatever that may be, you got to think about what makes sense in terms of questions using that particular modality of service delivery. And then the third thing is, if you're developing this tool, the next piece dimension is, if you're developing this tool, obviously it's going to be a tool that you are developing. So you're going to make sure that it matches who you are in terms of your usual clinical approach. And we all have a specific clinical approach. We may not have thought about it this way, but we all have it in a particular clinical approach that we're inclined to use that's unique to us. Some of us go into a clinical situation and we do a lot of talking early on and then let the client talk. Some of us go in and we kind of let the client do all the talk on the front end, and then we kind of chime in at certain points when we do a lot of talking, at the end of the client's having talked. So and that's just an example of a type of approach. And there are many different ways to think about clinical approaches. So obviously, when you put your tool together, it's going to mesh who you are and match who you are as a clinician, because you have selected the three theoretical or conceptual frameworks that will be the foundation for what the questions will be that will emanate from them in both of the three dimensions: cultural identity, human development, and outcomes of services. You are then working with a specific population of persons who have a specific malady or abnormality or health challenge you're dealing with. You also are working with them in a particular milieu or modality, and then it's all about who you are. So in the end, each clinician's three-dimensional model tool is unique to who he or she is, and that's fine because it matches who they work with and how they understand these areas. But the most important part is that you have a tool, that you have a systematic and routine process that you've already vetted, already developed, that allows you to use in a clinical situation, and that it matches who you are. Once your tool is developed, I encourage people to draw a picture about it, because Rudolf Arnheim did some work years ago, and he sort of made this positive that we really do think and recall in pictures, particularly people who have been sighted. In other words, who've had vision. Not so sure about people who've never seen, but if you have vision or have had vision, then a big part of our recall process is visual. In other words, we have that picture of things in our mind's eye to help us in our recall process. So if you have a picture that you have drawn that depicts and shows how your three-dimensional model tool is designed, then you don't really need to have paper or the questions written down for each of the three domains that you're going to ask questions about. It's already in your head as a visual image that then will prompt you each time you meet a brand new consumer of services, recipient of services. So that's all about, again, learning as much as you can about the service recipient's cultural identity and expectations about the outcome that she or he is seeking into your services. Strategy number 4, practice cultural competency in the delivery of healthcare services. Again, practice cultural competency. This really involves a couple of things. First, avoid collisions between your own worldview and your client's worldview. And a big part of that is knowing what your own worldview is. Remember, the first strategy we talked about was knowing that you are a cultural being and understanding your worldview and understanding your baggage and biases. So that feeds into the strategy 4. So once you know your own worldview, what baggage you have, what biases you have, then you have to find out the client's worldview. You're going to do that in our previous strategy, strategy 3, where we talked about building that tool that allows you to get to know who that person is. And then you have the ability with your own worldview understood and now have data on the client's worldview, you can avoid those natural collisions in worldview that might happen if you are not so informed about who the person is you're providing services to and about yourself as a cultural being. Secondly, you want to make sure that no matter what you do throughout the course of providing those healthcare services, you cannot ever disrespect anything about the service recipient's cultural orientation or background. And again, this requires that you have some familiarity with who that person is from a cultural orientation and background perspective. Hence the importance, again, of that systematic process that we just talked about in the previous strategy, number 3. So again, avoid those collisions between yours and the client's worldview and make sure you don't disrespect anything about who that person is culturally. Strategy 5. Strategy 5 is really about evaluating your effectiveness as a healthcare provider. And what you're going to do here is put together a process that allows you to systematically understand how well you're doing with the persons you're providing services with. And there are 2 particularly important dimensions here. First, you want to engage in what we call implementation, formative or monitoring evaluation. And that really will involve you throughout the course of the service delivery encounter that you have with a particular service recipient, periodically stopping and doing a status check to ask that consumer of services how things are going, get their input on the process. Because there may be things that are happening with the service delivery process that you're not aware of as a healthcare provider that may not be working so well for the service recipient. So you want to make sure that service recipient has the time and opportunity to voice that so that you're aware of it and you can make some adjustments as needed going forward. So that happens throughout the ongoing healthcare service delivery process as a way of monitoring and fixing and making mid-course adjustments to the delivery process. The second piece is to engage in what we call impact or summative evaluation. And there we're looking at what's the bottom line effectiveness of what you did. Did what you provide as a healthcare provider to this service recipient client produce any desirable positive benefit or impact for that person? Did you ameliorate whatever the health challenge was, or did you mitigate it to a point where it's well controlled? And so at that point, you want to understand that from 2 different perspectives. You want to know whether or not it was improved from an objective point of view. And there you're going to use those measures that are typically measures that the healthcare profession will give you. Indicators like blood pressure readings, A1C readings, depending on what their particular health condition is. If you want to know whether or not what you have done has actually helped that person improve their blood sugar level or improve their blood pressure. So you do those objective measures that really are measures of success that have nothing to do with what you think about whether that person's been successful or what the client or service recipient thinks about whether or not you've been successful. It's an objective measure. It's outside of bias from individual input that will speak to whether or not that person is actually functioning at a better level or improved level in terms of health status. And then you also want to look at those subjective measures. And subjective measures are things like satisfaction, where you actually ask the client or the service recipient, how was the process of receiving services for you? It looks like, the objective measure shows that X, Y, and Z, you're better or maybe not better. But I want to ask you from your perspective, from your eye, through your eyes, how did this process work out? And that's what we call satisfaction data. It's subjective. It's very much from the point of view of the person that you're asking. It's their opinion of how well the service encounter process went. With satisfaction data, you always have to have it because you always must know what customers think of the services you provided for them. But you have to be very cautious of how you interpret satisfaction data because satisfaction data can be tricky. It's a little bit fickle in terms of its orientation because there's always a person that you encounter in a healthcare process who, no matter what you do, they're not satisfied. You could cure them of cancer and they're not satisfied. They thought you should have done something more than that for them. And then you have the inverse of that, the person where they didn't get better at all in any way, but because you were there and you provided services and because they have deference to healthcare providers, they'll always say that you walked on water, that you did great things for them. So people come into these encounters with a certain mindset around satisfaction. And sometimes that's not changed no matter what happens. So you got to realize that as you interpret satisfaction data, it's not always a clean interpretation, but you have to have it because it's what the customers think. So that in conjunction with the objective data will give you a good perspective on whether or not the person has actually gotten better and you've been effective in your healthcare service delivery process. So with both the implementation and impact data, you have the ability to know how well you did, how well the process played out, and you have the ability to learn some lessons about your effectiveness as a healthcare provider. And those lessons are lessons that you then take with you going forward and make some changes as you need to, or reinforce some things, or keep doing some things that you're doing well as you go to see additional subsequent clients in your practice. So those lessons learned are what really make you better going forward as you're seeing new clients. So again, let's review those 5 strategies, and then we'll be moving over to our second segment, which is our discussion component. Remember, strategy number 1. Again, we're talking about culture and the delivery of health services where the rubber meets the road. Strategy number 1 is to realize that you are a healthcare provider and as a healthcare provider are a cultural being, and you have your own baggage and biases. And you must understand what those things are. Strategy number 2, you must recognize and work to establish that positive therapeutic alliance, that relationship, that rapport with the client that we know from the research literature is the single most important thing in having a service recipient view what you've done as having been successful. Strategy 3, learn as much as you can about the cultural identity and the orientation of the person providing services to, and about what that person expects in terms of outcomes of services. Strategy number 4, practice cultural competency in how you deliver your services. Strategy 5, evaluate your own effectiveness in providing these services on an ongoing basis. So just 5 strategies. They're difficult to do, but if you focus your attention on these, those of you in the trenches will have the ability to provide services that are more culturally competent going forward. So with that, I'm going to stop. And as in our usual tradition, we have a first segment where I do most of the talking. It's usually 30 minutes. Today we're less than that. And then we'll go over to our second half where we have our second component, which is really this discussion piece where you can make some observations, ask some questions, and we can engage with each other. So I'll see you in just a few minutes on the other side. Thank you.